We move to norepinephrine. It is a neurotransmitter in the central nervous system and the peripheral sympathetic nervous system. It's associated with arousal, anxiety, and stress responses. I think we all do a really good job with using this neurotransmitter in this day and age. We move so quickly and so fast. But you'll also notice that most children with autism have much higher levels anxiety and stress responses and may have abnormal arousal. Medication that's used that targets norepinephrine is clonidine. And actually, clonidine was developed as an antihypertensive drug, so it attacks the blood pressure. However, they've noticed that it decreases OCD symptoms and significantly reduces hyperactivity. The side effects are mild, but you really need to monitor because of hypotension. You don't, of course, want children with very low blood pressure wandering around. So now let's move to peptide research. Peptide research is very interesting and focused on neuropeptides because they are associated with the development of attachment, of bonding, and social behaviors. And social impairments have been found commensurate with levels of oxytocin in children with ASD. They have investigated whether the use of Pitocin, which speeds up delivery, is associated with that, but it has not been implicated as a cause. So much of the peptide research has been focused on endogenous opioids. And endogenous opioids are within our system and responsible for attachment and motor activity associated with high states of self-satisfaction, a really increased pain threshold, and a reduced responsiveness to social stimuli, which may even lead to social withdrawal. So, however, not all children with autism have this elevated levels of endogenous opioids. Normal to elevated levels are seen, but then become weaker as they grow older, and again, not in all children. So the medication that is called an opioid antagonist is naltrexone and naloxone, and it is used in severe self-injurious behavior. It's also used in other types of nervous system problems related to nerve pain because of its increased pain threshold. But it doesn't do that without cost. It does interfere with the brain functioning at that time, and we're just not sure, because children with autism, even adults with autism, aren't that great of reporters. We're just not sure at what that does.